Interestingly, while there's been discussion about alcohol as improving the risk for heart disease, there's only recently there's been some speculation about reducing the risk of certain cancers. It's mostly been, I would call, early data on the subject. I would be hard pressed to say that this would fall anywhere near the level of a public health recommendation or a health policy. There's some early evidence from a few studies that people who have moderate levels or higher levels of alcohol consumption have lower risk of non-Hodgkin's lymphoma and possibly of thyroid or renal cell carcinoma. But these are early studies, and I think are still in the realm of speculative and needing further research before a definitive statement can be made. And no one has a clue as to what the mechanism would be by which alcohol would be protective about it. This is a question that I'm asked quite frequently, mostly by patients who are undergoing chemotherapy for their treatment of their cancer. And certainly I would not recommend drinking to excess, but I don't know if I would recommend under any circumstance drinking to excess. But I think a drink or a couple of drinks now and then certainly don't have any negative impact on most treatments. Certainly, this is a question I would raise with your treating doctor, oncologist, or whoever if you're undergoing chemotherapy. But as a general principle, I don't think a drink or two is of any ill effect. From a health policy point of view, I think it's fair to say that tobacco is the main culprit that we're aware of in terms of cancer prevention, and it's certainly anyone who's smoking is literally playing with fire and should certainly stop. After that, I think the kinds of advice that is combined with cardiac disease prevention is also reasonable. Lowering your weight, increasing your physical activity, lowering your lipids are all reasonable preventive actions that would go in concert with improving or lowering your risk of cancer. There are also screening tests that are available for cancer that are highly recommended, including breast screening and colon screening and cervical cancer screening for women. And then, as I said earlier, probably a prudent diet, which would go along with weight loss and the other activities. It may have other benefits as well. I think once we go beyond that, we go into a realm of speculation as to whether these things are helpful or not. There may be other things that are out there on the horizon. There's a great deal of research going on now to develop more preventive agents. And I should mention vaccines for those diseases that are preventable by vaccines. Most children now in Western countries are getting, and actually in other areas of the world as well, are getting vaccines against some of the preventable causes of cancer, such as hepatitis B and HPV. I would say, though, that I think the future holds great promise in this regard, of prevention, that is, and I think the reality is that most of the great advances in medicine have been in prevention. The great advances in infectious disease, which is where we've made the greatest strides in medicine, have been not through antibiotics, but through washing our hands and having clean drinking water. rather than through treating people who get sick. And I think the same will ultimately be true in cancer as well. It'll be by reducing cancer risk, not by treating people better who have cancer. We should try to prevent that. I think they should talk to their doctor about their concerns, tell them if they have a special reason for being concerned. Some people do. They may have a family history. They may have noticed some symptom which has been in the back of their head and they just haven't gotten around to it. This is so common, it's almost it's a daily occurrence in any practitioner's practice to find someone who's had rectal bleeding or a palpable breast mass and has been ignoring it for a long time. Certainly patients should bring that to a physician's attention as rapidly as possible. But they should talk about what their concerns are and why they have them, and then discuss with him what he feels or she feels are the appropriate measures they should take for prevention. It may be appropriate, for example, to have genetic testing if they have a family history. It may be appropriate if they're smoking or if they're overweight or other things of that ilk to undergo or to have a prescription for and advice for how to go about getting prevention in their regimen. I think we're more used to this in the context of cardiac disease. I don't think anyone would be shocked to hear that for high blood pressure one should take a medication, or for lipids, for high cholesterol, that one should change one's diet or take a medication for that as well. Somehow in cancer, I don't think the message has yet become as well known, and many of the activities were almost the same and almost as effective.